You are watching IPT News, a link between media, communicator, and the viewer.
This is IPT News reporting from Premier Senior Hospital, Attapur, Hyderabad, a hospital for senior citizens.
What are the challenges that you generally face to provide the treatment for the elderly patients
There
at your
are.
Premier Senior Hospital?
See, treatment of elderly is quite different from treating normal regular patients. They have multimorbidities, number one, which means they have diabetes, they have hypertension, they have other conditions also, and osteoarthritis, movement disorder, so many things are the Parkinsonism. So it's a multimorbidity we have to tackle all in a multidisciplinary manner. We have to involve a neurophysician, sometimes we involve a psychiatrist, memory specialist, and a physiotherapist. These are the main people who we involve while treating. Number two is ageism is another thing. In social, it is a people think that it's a curse. Old age means they cannot do anything. That is the people's perception, society's perception. That has to be broken down. We should tackle the society. At least we doctors, we must tell them that the people who are aged are not all aged people are not means without any. They are useless. They are very much useful if they are healthy. Their wisdom is not tapped in our country. 60 to 80-year people who are healthy enough, who have got a good memory, is like a grey brigade. They are people with so much of usefulness in the society. That is being not tackled because they once they are retired, they are psychologically also become depressed. Suddenly, after having a very big post, suddenly they become it becomes a complete stop for them, and they go into depression. Many people go into depression. That is one thing. Next, number three is we polypharmacy is another thing which we have to tackle. I get patients with big bundles of files. Different doctors have treated them. Cardiologist treats with his own medicine. Diabetologist treats with his medicines. So many medicines will be there. So I have to de-prescribe many medicines. I reduce the medicines, and they sometimes they cling on to that, and they say that why cardiologist has written this medicine, how can I stop like that? So it is a complete different. The approach to an old person is completely different. We have to reduce the medicine. They don't know that many medicines are causing side effects to them, and they are treating those side effects again. So it is, and we have to treat the old people like any young infant. So very important, and so many minor things, minor changes in their habits can give a lot of difference in the long run.
What is the Premium Senior addresses memory loss in the elderly patient, and what is the specified therapy and the treatment given for the memory loss?
As I told you, there is no specific treatment for memory loss. There are 3 or 4 medicines like the donepezin and other things which we regularly give. But now some medicines are under trial, which we are also trying. Another thing is the 3D stimulation of the brain. Then discussing about their old profession. We get patients, for example, I got a football player who was retired, who was losing memory, and if I talk about the football to him, he will talk very nicely. Everything he remembers. But if you talk any other thing, he will not remember. He will not remember the son's name. But football fullback, who was fullback, he will tell. So that is very important. So time and some allocated person should be there to talk with them, number one. Then we have brain stimulation games are there, like chess, Sudoku and other things, are drawing a clock and asking him reverse, tell the number 3 in reverse manner. So that way we stimulate. And then for cognition, we will ask them to play a ball with 2 balls like that. So that cognition improves with that. So there are different. It's a completely different subject, and we have a specialist in memory who does all these things. We are experimenting with 3D also. We put a 3D that game thing, Xbox like thing, over the elderly people, and we take them into a certain serene atmosphere sometimes, and according to his background, we take them into that. So that stimulates the brain.
Percentage of recovery?
There is no recovery as such, but we can delay the progress.
Okay.
See, it's a very bad situation for the relatives. The person will not be even under recognize his son only. When we have a patient who, and son is so much interested to improve, but she doesn't recognize the son. So we are there are some stimulants like black, what is called a bullet coffee, in which we give coffee with ghee and MCT oil. These three things are mixed and we give that. Coconut is supposed to be very good, so we try to give more coconut. We prepare food with coconut oil and those things. This is important for them. So these things have to be done. Another thing is Parkinsonism. As I told you, there are reversible causes also. Parkinsonism. If you treat Parkinsonism, the memory improves. If you vascular dementias are there, in which we improve the circulation of the brain, so memory can improve. Blood pressure, if it is controlled properly, circulation improves to the brain. So many things are there, minor things. Such steps have to be taken. At least you can delay.
कब से इलाज चल रहा है और क्या इलाज चल रहा है? एक्चुअली इनका न्यूरोलॉजी का प्रॉब्लम था पहले, उसके बाद वो गिर गए थे घर पे, तो उनका एक फ्रैक्चर हो गया था। बहुत एक्सपीरियंस है। आपको अच्छा नॉर्मल लग रहा है, ठीक लिख रहा है सर, तबीयत भी
Thank you for watching IPT News.